Doctors fresh out of medical school could work around the clock under new rules. But this is raising concerns about patient safety. The schedule changes taking effect this Saturday increase the 16-hour shift limit for first-year residents to 24 hours. Dr. Narula shows us what it means for patients and for their doctors. Tara, good morning.
Good morning. This issue has been under the microscope for 3 decades. The ideal working hours for both medical care and on-the-job training. 30,000 first-year residents start work July 1st. Although the new rules could add 8 or more hours to their shifts, many are actually welcoming the longer days. Melissa Garuthera's day starts at 5 a.m. when she reports for rounds at Long Island Jewish Medical Center.
How's your pain?
It's gone down like a 5.
During her first year as a doctor, she's required to clock out after 16 hours, even when she wants to stay longer.
I don't want to say, oh, you know, I'm leaving for the day, but the night intern's going to come and check on you. I want to be the one doing that.
When Stefan finishes, he'll take over.
Critical patient information is relayed during handoff to the incoming shift.
We're going to 9 and then to 2.
Shorter shifts increase handoffs, bringing more opportunities for error and interruptions to doctor training.
Medical emergencies don't all occur between 8 and 4.
Dr. Rowan Zetterman helped update the rules to bring training in line with the realities of hospital care.
And when you had one resident that was only there 16 hours and another resident that was there 24, it interfered with the team-based care that occurred.
Under the new rules, first-year residents can choose to stay even longer than 24 hours. To an average maximum of 80 hours per week.
We should keep in mind interns have just graduated medical school. They're the least experienced, the least knowledgeable members of the medical team caring for patients.
Dr. Sammy Almashot tracks doctor training for Public Citizen.
So what has been considered a rite of passage, working longer hours, being strong, can actually be detrimental to the patient and the resident?
Yes, that's what the evidence shows unequivocally.
A Harvard study found that residents made almost 36% more serious medical errors when working 24 hours or longer.
They're coming up against the limits of their capacity to function, and all they can think about is sleep.
Are the pain meds taking the edge off?
About to start year 2, Dr. Garuthera says extended hours might have enhanced her first-year training.
I can read about it, I can watch YouTube, I can do anything from home. But it's not going to be the same as, you know, being bedside with a patient.
So you haven't heard a lot of commiserating amongst the residents about how many hours you have to work and about fatigue?
Obviously, we can get tired. I think that the idea of the intern as a creature that lives in the hospital and comes out after 30 hours in like a dark closet, I think that's kind of archaic now.
Keep up the good work.
Of course, and we'll come back and check on you later.
Thank you so much. Thanks a lot.
A key goal of the new rules is to help doctors become more invested in their patients by avoiding a shift work mentality.
So I go to talk to you in the green room before you come on, and I said, who could possibly think this is a great idea? And you go, I actually do. And all of us at the table are going, what?
I know, it's a complicated issue. You definitely are exhausted, but I do think it can enhance learning because you're there to see the arc of the disease, and you do feel more invested in the patient because it's like your family. You want to see everything through.
Tara.
Yeah. You are
Enhanced
tired.
learning, but what about the patient's quality of care?
Well, you're training doctors for the rest of their life, though, so you want to make sure they're, you know, as well trained as possible, preserving safety for.
Thank you, Tara.
Okay, doctor.
Good debate to have.